Hernias, a common health issue, but can cause pain and discomfort. If left untreated, they can lead to serious complications. There are treatment options, though, that can help. So joining us to talk about this, put the spotlight on it a little bit, if you will, is Dr. Xanthoudakis, a general surgeon with Bartow Regional Medical Center and BayCare Medical Group. Doctor, welcome to the show. How are you doing today?
I'm doing great. Thank you so much for having me.
I feel like a hernia is one of those terms that are just kind of thrown out there almost.
Sure.
So let's really dive in. What is it? Let's talk symptoms. Give me the hernia 101, if you will.
Sure. So a hernia is a defect or a opening in the abdominal lining, either in your abdominal wall or groin region, where either a piece of fat or intestine can kind of poke through and cause you to have some symptoms. Very common thing that people see, mostly seen if they're kind of straining or standing up, okay? And most of the time a person notices it as a lump or a bump or some sort of mass that they feel either in their groin or their belly region. Most commonly in the umbilical region or the groin region. And sometimes if you had a prior surgery, you may even have it in the area of your prior cuts.
Good point. And I'm curious, again, if people do kind of say they're lifting, and you kind of feel that lump, what are the ways, though, to fix it? I mean, of course, I think of surgery. Is that the main way? Is that the main solution?
Sure. So hernias don't get smaller. If you have a small hernia and it's really not bothering you, but you know it's there, you can just kind of leave it be and monitor it. But overall, hernias get bigger with time. And so the main way to fix those is surgery for a definitive repair.
Safe to say, so if they don't go away on their own and you have to have surgery, is it better to have surgery sooner instead of waiting until it gets larger?
Sure. I'd say that if you know you have a hernia and you're having any symptoms including, pain in the area, discomfort, a bulge that's getting bigger, and some of the really bad symptoms that can be concerning for a medical emergency include nausea, vomiting, and severe pain. That would be concerning for a surgical emergency and something you would want to seek immediate medical attention.
And I'm just curious, Doc, as we, of course, get ready to wrap up, let's talk about how you're able to treat, though, at BayCare through robotic surgery. I mean, that's got to be something that you've just been able to see the advancements happen.
Sure. I'm minimally invasive robotic surgeon trained, and I'm lucky and fortunate to be able to use the Da Vinci robot at BayCare Health at Bartow Regional. And so I do all of my incisions with small cuts about the size of my fingertip, okay?
Oh, wow.
And I'm able to fix pretty much any hernia of the abdominal cavity or the groin. And the nice thing with these small incisions, whether you have one hernia or three hernias, I can fix them all at the same time with those small incisions.
Oh, wow.
And so that allows patients to have decreased risk of bleeding, decreased risk of postoperative infection, decreased risk of pain after surgery, faster recovery time, and overall faster ability to get back to normal activity.
Oh, that's all good to hear if people are suffering from a hernia.
Definitely.
Well, last question, of course, before we share contact information. Would you say hernias are common?
Hernias are very common.
Yeah.
I see them very often. Sometimes people are born with a hernia. They may have one at birth as a defect, such as an umbilical hernia or a small inguinal hernia. And then other times people get them, with time from heavy lifting. Sometimes they notice it when they're doing really physical activity or lifting something heavy. They feel a little pop and they're like, that's when I notice that now I have a hernia. And so that's when I would say, go see your local doctor or surgeon, and they can usually take care of it with, small incisions.
Well, again, I'm glad we did a little hernia 101, if you will, doctor. Thank you so much for your time and, of course, sharing this important information. For more, you can, of course, visit the website baycare.org.
Thank you so much. Have a great